recess. So what is frontal recess was previously known as the nasofrontal duct. So now what are the boundaries of the frontal recess? As we have seen previously, after the frontal bone, when the frontal beak disappeared, we saw the frontal recess area. So now what are the boundaries of the frontal recess? So considering this as the frontal recess area, laterally it is bound by the lamina papracia, medially it is bound by the middle turbinate, and anteriorly we already saw that it is bound by the agar nasi, and posteriorly it is bound by the bulla ethmoidalis. So these are the boundaries that we need to know. So now the relation of the frontal ostium with uncinate process, I'll show you. So this is the coronal section and this is the sagittal section. So here, as we should know that frontal ostium is the narrowed portion which lies just opposite and behind the frontal beak area. So this is the frontal sinus area. This is the this narrowed portion is the frontal ostium area, and this is the frontal recess area. So this in this figure we can see that that the frontal sinus area is widened. This ostium area is narrowed, and again there is widening in below. So this looks like an hourglass, and hence it has been correctly termed as an hourglass appearance. So if there is a large agar nasi cell, it narrows down the frontal recess. Even we know that the posterior relation is bulla ethmoidalis. So if bulla is also large, then there is a narrowing of the frontal recess, leading to the difficult frontal sinus drainage. So now what are frontal cells? Frontal cells are the pneumatization of the frontal recess area by the anterior ethmoidal cells. So the frontal cells are further classified as KUHN's classification. So we have 4 types of frontal cells according to KUHN's classification. Type 1 is any cell above a single cell above the agar nasi. So this is the agar nasi. A single cell above the agar nasi is known as type 1 frontal cell. This side you can see this is the agar nasi cell. 2 or more cells above the agar nasi is known as the type 2 frontal cell. So now in this picture, this is the agar nasi cell. This is a single cell above the agar nasi. So we might think this is a type 1 cell, but this is not so. Why? This is because type 3 cell is any cell above the agar nasi which will lie less than 50%, which will occupy less than 50% of the frontal sinus. So if this is the frontal sinus, this is 50% of it, it lies below 50% of it, and it has an indentation within the frontal sinus. So this is a type 3 frontal cell. So now this is the type 4 frontal cell in coronal section. Type 4 is when we have a cell above the agar nasi which has occupied more than 50% of the frontal sinus, or a single cell lying within the frontal sinus known as a loner cell. So in the sagittal section, this is further very clear. So this is the agar nasi. A single cell above it is known as type 1. Agar nasi, 2 or more cells above it is known as type 2. This is the agar nasi. A cell above the agar nasi, but which is below 50% of the, which is occupied less than 50% of the frontal sinus. This is type 3. Here, type 4 is 2 types. When it has covered more than 50%, this line denotes 50%. So when it has covered more than 50% of the frontal sinus, or a single cell within, which lies completely within the frontal sinus, is also known as loner cell, and this is type 4 frontal cell. So now nasolacrimal duct. So when we move through the dynamic CT scan, how do we identify the nasolacrimal duct? A nasolacrimal duct, we need to trace the frontonasal process of the maxilla. So along the lateral wall of the nose, medial to the frontonasal process of the maxilla, when we find a tunnel-shaped structure, but opening into the inferior, in the inferior opening into the inferior meatus 1 centimeter behind the anterior end of the inferior turbinate, then we know that this is the nasolacrimal duct in the coronal section. Now in axial section, we actually see better how if this is the maxillary sinus, we need to go anteromedial to the maxillary sinus, and along the frontonasal process, we see a circular opening, and this is the nasolacrimal duct. So here, so we have, this is the nasolacrimal duct.